بسم الله الصلاة والسلام على رسول الله سيدنا محمد صلى الله عليه وسلم وبعد. في سلسلة محاضراتنا في مقرر أو عن مقرر الفايتوثيرابي، هنتكلم عن في الفايتوثيرابي and health. هنشوف aromatherapy and homeopathy system of medicine. قبل بداية أو تحدثنا عن الهوميوباثي and aromatherapy, we have to know important terminology اللي هو الكام. What is a CAM? CAM is a complementary abbreviation for complementary and alternative medicine. It's considered as a group of diverse medical and health care systems, practices, and products that are not presently considered to be part of conventional medicine. In other words, CAM هو طب التكميلي أو طب البديل. التكميلي والبديل مع بعض complementary and alternative medicine. هو مجموعة من الميديكال health and healthcare systems بالإضافة ل practices و products. system, products and practices كلهم مع بعض are not considered as a part of conventional medicine or the Western medicine which we practice currently. Conventional medicine is a medicine that practiced by holders of MDs, or which we know medical doctors, and by their allied health professionals such as physical therapists, psychologists, and registered nurses. الconventional medicine أو الطب هو المعروف إنه هو الميديكال medicine that practiced by الفيزيجنز اللي هم الميديكال دكتورز والاللايد هيلث بروفيشنالز السايكولوجيست الفيزيكال ثيرابيست والنيرسز and so on. ده what we currently أو حاليا هو موجود عندنا في البراكتس. فأي براكتس غير conventional medicine بنخط في الكومبلمنتري and alternative medicine اللي هو including aromatherapy including الهوميوباثي. Some healthcare providers practice both CAM and conventional medicines. بنلقى بعض الفيزيجنز بيشتغلوا both اللي هم complementary and alternative medicine beside the conventional medicine. As we said previously, إنه complementary and alternative medicine هو practices و system بالإضافة ل products. في عدد من الماتيريالز مستخدمة في الكومبلمنتري ميديسينز اللي هي زي المينرالز مثال اللي هو السيلينيوم أو البلانت and animal tissues أو الريفايند فورم of animal and plant tissues بالإضافة ل اللي هو including الكيميكال سبستانس زي جلوكوزامين هيدروكلورايد اللي هو purified extract من الانيمال tissues. برضو الماتيريال المستخدم في complementary ممكن تكون fully or partially synthesized أو derived. زي جلوكوزامين هو purified ممكن يكون semi synthesized أو completely synthesized in the lab. فالcomplementary medicine هو أو complementary medicinal products come under regulation of OTC اللي هو over the counter products أو over the counter pharmaceuticals. It is important to know the definition of complementary and alternative medicine and the definition of integrative medicine, which are completely different. The National Council of Complementary and Alternative Medicine defines CAM as a group of diverse medical and healthcare system practices and products that are not presently considered to be part of conventional medicine. التعريف اللي قلناه في البداية هو health system practices و products. يبقى الانتجريتيف ميديسين هو combining mainstream medical therapies and CAM therapies for which there is some high quality scientific evidence and safety and effectiveness. يبقى الانتجريتيف ميديسين هو الطب التكاملي بيجمع لي الكام ثيرابيز مع الكونفنشنال او المينستريم ثيرابيز اعتمادا على الهاي كواليتي scientific evidence for effectiveness and safety. بعد عرفنا انه الكام او الكومبلمنتري alternative medicine واحد منهم هو الاروما ثيرابي، وقلنا الكام هو مجموعة بتاعت health systems practices and products. فالاروما ثيرابي as branch of complementary and alternative medicine او ممكن يعتبر integrative medicine اذا تم استخدامه ببعض الفيزيجنز او الهيلث كير بروفايدرز. فالاروما ثيرابي defined as the systematic use of essential oil in holistic treatment to help improve physical and emotional well-being. هو systematic use يبقى system of using essential oil in holistic treatment. يبقى الابروش في التريتمنت هي holistic او شامل to improve physical and emotional well-being. يجمع لي التحسن من الناحية الفيزيكال او الناحية العضوية والناحية النفسية. طيب قلنا في الاروما ثيرابي هو systematic use of essential oil in holistic treatment. طيب why is aromatherapy often referred to as holistic therapy? Aromatherapy is truly holistic therapy as it aims to treat the whole person by taking account of their physical and emotional state, which can have a profound effect on general well-being. Besides, it works on the principle that the most effective way to promote health and prevent illness is strengthening the body's immune system. In so doing, it is helped to restore the harmony between mind and body. This is why aromatherapy is known or referred to as holistic therapy, because its approach for treatment focus on the whole person, taking account physical and emotional state. Besides, it focus or work on the principle that most effective way to promote health and prevent illness is to strengthen the body system. aromatherapy هي holistic therapy بتركز على الهول بيرسون، بتركز على الجانب الفيزيكال والايموشنال، وبتعتبر انه البودي اميون سيستم هو الكي فاكتور لعلاج كل مشاكل البودي او البيرسون. طيب نشوف التطور او الديفلوبمنت اللي حصل للاروماثيرابي from its primitive use by Egyptian time لحد ما بقى complementary therapy today او بقى طب تكميلي. طيب إذا عملنا فزلكة تاريخية بدينا ancient Egypt، نلقى إنه first evidence of the wide ranging use of aromatic oils come from ancient Egypt اللي هما لقينا Egyptian extracted the oil by method of infusion and use them as cosmetics. طيب كبداية إنه القدماء المصريين استخدموا أو اكتشفوا أو invent method of extraction by infusion واستخدام essential oil in cosmetics. في الإغريق أو الجريكس هيرودوتس والفيرست بيرسون to record the method of distillation of turpentine اللي هو كان around سنة 425 بي سي. بعد ذاك الجريك soldiers carried the essential oil زي المايرة in bottle for treatment of wound. برضو في الجريك period هيبوقراط اللي هو الجريك physician wrote about a vast range of medicinal plants and claimed that the best way to achieve good health was to have an aromatic bath and scented massage every day. Okay. يبقى هيبوقراط اللي هو invented أو اكتشف لنا استخدام الأروماتيك باث واستخدام المساج to achieve a good health or a well being. Okay. اللي هي later on بقت واحد من التريتمنت ميثود المستخدمة في الأروما ثيرابي. يبقى باختصار الأجهد Egyptian discovered the extraction essential oil by infusion واستخدام essential oil by cosmetics. عندنا في الإغريق أو الجريك عندنا هيرودوتس اكتشف لنا الميثود أو سجل ريكورد الميثود of extraction by distillation للتربنتين oil. والإغريق soldiers use المايرة في البطل treatment of wound لو عنده wound healing effect. وهيبوقراط اكتشف لنا استخدام الاسنشال اويل في to retrieve أو to restore a good health by using aromatic bath والscented massage. وصلنا في الأروماثيرابي development وفي لو جينا للأمة العربية لقينا هنلقى إنه ابن سينا اللي هو العرب فيزيجن هو بالإنجليزي بيسموه أفيسينا wrote over 100 books describing over 800 plants and their effects. والimportant contribution of ابن سينا أو أفيسينا في الأروماثيرابي هو development of more primitive form of distillation اللي هو used to produce pure oil and aromatic waters. قلنا الإغريق هم أو هيرودوتس the first person record distillation method of turpentine. أفيسينا عمل شنو جه اشتغل على distillation method وعمل له development هو برضه more primitive form of distillation method لكن حصل تطور في الميثود واستخدموا لل production of pure oil وكذلك production for aromatic water. بالنسبة للإنجلند the earliest written record of use of aromatic oil in England was in 13th century اللي هو the founders or the person who established aromatherapy in England attributed to René Maurice Getfoss. René Maurice Getfoss هو French perfume chemist who first used the term aromatherapy in 1928. ففي الإنجليز هما earliest record بالنسبة للأروماتيك أويل في القرن السادس عشر والفرنسيين اللي هو عن طريق البرفيوم كيميست اللي هو ريني ماوريس جيتفوس هو the first chemist who used the term aromatherapy. استمرارا لمجهودات جيتفوس اللي هو introduce the term aromatherapy في سنة 1900 يعني في القرن تقريبا 1929 بنلقى دكتور جين فالنيت translated the practice of aromatherapy في his book اسمه aromatherapy. okay. لو confirming الفايندينج بتاعت جيت فوس has become an established textbook among serious aromatherapy practitioners. يعني برضه بيحسب للإنجليز. By the middle of 17th century, the role of essential oil was reduced to being employed in perfumes, cosmetics, and food industry. يعني برغم من ال invention of aromatherapy terminology by Getfoss و textbook بتاع aromatherapy by دكتور جين فالنيت اللي هو عمل أو translate the practice of aromatherapy في البوك بتاعه، إلا إنه في منتصف القرن العشرين الرول بتاع essential oil قل شوية من التريتمنت، بقى محصور في الاستخدام في البرفيومز والكوزماتكس والفود اندستريز. وبنلقى إنه في 1950 aromatherapy introduced to Britain أو to England by Margaret Maury. هي Australian biochemist، هي طالبة بتاعت Guidefoss, student of Guidefoss. She wrote her book The Secret of Life and Youth, in which she established the use of essential oil in cosmetics and massage. As we said, aromatherapy is a holistic therapy designed to treat the body in a holistic approach. It is used essential oil as material of treatment. A theory and basic concept of aromatherapy. Before we start theory and basic concept, we have to know some terminologies. عندنا spherology. spherology هو عبارة عن science that study the physiology and other aspects of action. In spherology, the chemical molecule or the volatile molecule of aroma carried by air come in contact with anatomical structures known as receptor later on, where interaction occurs and the signal produced of particular other characters. Then this signal or the character of other conveyed to brain, where these characters are stored in memory. يبقى الفسيولوجي في البروسيس إنه الكيميكال molecule interact مع anatomical structures generate a signal وهي characteristic for particular other. This signal is stored in memory in the brain. In other words, spherology is an interdisciplinary science involving molecular physics to psychology. قلنا الspherology هو study of physiology of action، وهو interdisciplinary science that relate between or that involve molecular physics and psychology. Recently, researchers of Weizmann Institute illustrate the correct principle of smell. They found that the aroma can attach or connect to anatomical structure or can stimulate the G protein through a receptor. A G protein stimulation promotes adenylyl cyclase, and adenylyl cyclase manufacture AMP, which increase the permeability and allows the ionic compound to travel as electric impulse along the nerve fiber to the brain. Okay. يبقى ال correct principle of smell, the aroma molecule connected to anatomical structure linked to G protein stimulation, promote adenylyl cyclase manufacture, and adenylyl cyclase manufacture promote AMP synthesis. AMP increase permeability وبالتالي can generate electric impulse along the nerve fibers to brain, in which the memory or the character of other is stored. So we can summarize the principle of smell as follow: aroma through the nose can interact with anatomical structure in the nose, generate or can connect to G protein receptor. G protein receptor stimulate adenylyl cyclase. Adenylyl cyclase manufacture AMP. AMP increase permeability, allows ionic compound to travel as electric impulse along the nerve fiber to the brain. The process of diagnosis in aromatherapy involves two steps. The first step, when the patient visits a professional aromatherapist, he will investigate about the diet, lifestyle, various symptoms, patient illness, if any, and treatment undergo. After taken the patient history, establishing diagnosis, he find out the right essential oil as a remedy to initiate the treatment. So the process of diagnosis in aromatherapy involves two steps: taking the patient history regarding patient diet, lifestyle, patient symptoms, and past illness. بعد ذاك he decide to prescribe the right essential oil as remedy or as treatment. After aromatherapist formulate or create a complete picture of diagnosis of the patient state, he prescribe an essential oil as therapy. There are many types of methods using essential oil for treatment اعتمادا على a type of symptoms. One of the methods used for applying essential oil for treatment in aromatherapy is massage. Massage considered as most effective method for using essential oil because it combines their properties of essential oil with the therapeutic power of touch or mechanical touching. In fact, a massage technique based on scientific Chinese massage, which emphasizes on a specific pressure point and work down to lymph node. Another method of treatment using essential oil is a bath. Using oil in bath is simple, effective, and pleasant way to relax and receive therapeutic effects. We have two types of bath: partial or full bath. In partial bath, It may be partial for foot or hand. In this case, 4 to 8 drops of essential oil in a bowl of warm water is used for soaking the foot or hand for 10 minutes. You have bowl for warm water. We add 4 to 8 drops of essential oil, so you can soak your hand or feet or foot in the bath for 10 minutes. In full bath, 5 to 10 drops of oil is added to warm bath and the body immerses in it also for 10 to 20 minutes. Another method of applying essential oil in aromatherapy is inhalation and perfumes. In inhalation method, 6 to 8 drops of essential oil are added or sprayed or sprinkled on tissue paper or in a bowl of hot water and inhaled for 5 to 10 minutes, keeping the eye closed. It is worth mentioning in inhalation is contraindicated in asthmatic patients. In perfumes, you can make your own distinctive natural perfume by blending different oils. Try experimenting with different combinations, which can be mixed with carrier oil or non-fragrant alcohol. In general, in perfumes, you can add a natural perfumes in a carrier oil or non-fragrant alcohol. The last two methods of applying essential oil in aromatherapy is vaporization and oral administration of essential oil. In vaporization, the essential oil can be used to deodorize, fumigate, or simply create a special atmosphere. Because essential oil are having antiseptic properties and evaporate easily, so they make very good refreshness or very good refresheners. Inhaling the vapor can also be therapeutically beneficial. So vaporization بنستفيد من خاصية إنه essential oil عندهم antiseptic وعندهم قدرة إنهم to be evaporate أو volatile at room temperature، وبالتالي بيكون هما very good refreshers or fresheners. فبنستخدم different oil لغرض creating a special atmosphere. فالانهيليشن للفاور موجود في الاتموسفير بيكون عنده therapeutic effect. The last method of applying essential oil in aromatherapy is oral administration. The medicines for internal administration are prepared in form of teas, mouthwash, liquid، وريسنتلي اللي هو في soft gelatin capsule. Therefore, form in which or by which essential oil administered orally، يا بشكل تيز أو بشكل ماوس ووش أو بشكل ليكويد أو في شكل soft gelatin capsule. في حالة الأروماتيك تي اللي هو prepared by using 3 drops of essential oil in 1 تي ساشيت، والساشيت الواحد بيستخدم for making 3 to 4 cup of teas. بضيف الأويل للهيربال تي في الساشيت ب 3 دروب من الأويل في الساشيت of herbal tea. فذاك الساشيت الواحد can be used for making 3 to 4 cup of teas. There are a number of aromatic oil used in certain conditions. For example, the thyme, lavender, and eucalyptus oil are used for animal bites. Camphor oil, menthol, and clove oil are having antiseptic effects. Thyme oil having antiseptic effect. Calendula, wintergreen, black mustard are used for arthritis. Geranium is used in blister. The oil of garlic and oil of onion are used for bronchitis. Lavender oil used for burns. Peppermint and thyme oil used for constipation. Eucalyptus, ginger, and thyme oil used in cold, where ginger and geranium are used for cramps and chills. Jojoba oil and rosemary are used for dandruff. Parsley or baqdunus used for as diuretic. Caraway and cardamom are used in digestive disorders. Chamomile used as anti-inflammatory for fever, and lavender is used for headache. Lemongrass, thyme, and anise oil are used as insect repellent. Benzoin, basil, and thyme are used in respiratory disorder. Benzoin, basil, and thyme oil are used for respiratory disorder. Ginger and peppermint used in vomiting. Lavender and chamomile used in wounds, and chenobodium used to repel worms. There are safety issues and contraindications should be taken in consideration by both by practitioner and by the consumers. One of the important things is that don't take essential oil by mouth unless it is formulated in the final dosage form in capsule or in soft capsule. When applying essential oil to skin, always dilute essential oil in a carrier oil. Carrier oil means use of fixed oil such as arachis oil or sesame oil or coconut oil and so on. Keep essential oil away from your eyes and away from reach of children, of course. Check for allergies to essential oil or even to the carrier oil by batch testing. See your doctor immediately if you react to any product. Some medications having interaction with essential oil, their effectiveness may be increased. So speak to professional before using essential oil yourself. Never apply essential oil to broken skin or open wound. Important thing: avoid using uh, sunbed or sunbathing after applying citrus oil. Why? Because citrus oil increase skin sensitivity to sunlight. They are considered photosensitive. Both the carrier oil and essential oil are experienced to produce allergies. So a particular attention should be taken to carrier oil linked with food that often cause intolerance, such as sweet germ, avocado, peanut, sweet almond oil. Uh, all of them can produce or can cause the adverse reactions. Also, citrus allergies to essential oil is very common. So the caution should be taken when using citrus oil such as lemon oil or bergamot oil or orange oil, tangerine oil, lime oil, mandarin, neroli, and beet grain oil. Also, for patients with high blood pressure, avoid rosemary, peppermint, hyssop, and eucalyptus. In cases of high blood pressure, and avoid ylang where there is low blood pressure. In asthma, avoid the use of eucalyptus, and in liver disease, avoid using parsley seed and bay. Also, in kidney disease, avoid the use of parsley seed. In fever, avoid hyssop, rosemary, yarrow, and all varieties of lavender. اللي هم apart from lavandula angustifolia. As we said previously, essential oil always used in dilute form. They diluted in carrier oil or in fixed oil. So, what is the basis of blending essential oil with their carriers? We can take facial oil for acne vulgaris as example. The blend specifically for the face tend to involve using some of richer, more expensive carrier oils such as argan, evening primrose, avocado, and jojoba. These are the carrier oils. As a rule, if you are blending separately to treat the face, use 1 drop of essential oil and 5 ml of carrier oil for the face. 1 drop of essential oil in 5 ml of carrier oil for the face. As example, you can use 1 drop of rose and 2 drop of lemon and 1 drop of juniper oil in 20 ml of carrier oil for treating acne vulgaris.